Hi, I'm Danielle and I'm going to be the patient Rebecca.
Hi, I'm Liz. I'm going to be Rebecca's husband, Jack.
Hello, I'm Kate, the SLP.
And I'm Lindsay. I'm going to be the narrator. Our patient Rebecca is a 75-year-old woman who has a history of dementia and recurrent aspiration-related pneumonia, leading to frequent hospitalizations. This admission, she presented to the hospital with an acute altered mental status due to sepsis. Rebecca and her husband Jack are meeting with our SLP Kate in order to discuss the results of her most recent modified barium swallow study. Prior to admission, Rebecca had been on a diet of puree foods and honey-thickened liquids. After completing the swallow study, it was determined that Rebecca's dysphagia had significantly worsened since her last instrumental assessment. The MBS revealed silent aspiration of most bolus consistencies, and due to her altered mental status, she could not consistently retain any compensatory strategies to improve her swallow function. It was recommended that she consume nothing by mouth and that her primary care team should consider exploring implementing an alternative source of nutrition and/or comfort feeds. Following these results, Jack and Rebecca were seen by the palliative care team to discuss considering a change in code status to do not resuscitate, do not intubate, given Rebecca's overall declining medical status and recurrent aspiration-related illness. Following this meeting, the SLP returned to discuss Rebecca's plan regarding her diet options.
Hi, I don't know if you remember me, but my name's Kate. I'm one of the speech and swallow therapists that's been working with your wife. Hi, I'm Kate.
Please don't wake her. She's had a rough night and I really want her to get some rest. Can we talk over here?
Sure, we've been working together on her swallowing and, I'd like her to be involved in the discussion as much as possible, but I can absolutely go over things with you first.
So you're the one who's telling her that she can't eat.
We're the ones who met at her diet recommendation, yes.
I just don't know what everyone's been talking about. Why is everyone giving up on her all of a sudden?
I'm sure this seems like a lot of information to process all at once, but I hope I can answer some of your questions. If you want, we can start by discussing your wife's most recent swallow study.
Okay, I hope you have some good news for us. Nobody else seems to.
I'm sorry to hear that. Unfortunately, we noticed that things do seem to be getting worse with Rebecca's swallow. When we watched her eat and drink under the x-ray, we saw that most of the food and drink were going towards the lungs instead of her stomach, which, as you know, is what we call aspiration. In the past, Rebecca has had success with softer foods and thickened liquids, but this time she wasn't able to swallow those foods successfully.
You're saying this happens every time?
It happens enough to cause concern, especially now given her medical condition and the fact that she's not up and moving like at home. We're even more concerned that her body won't be able to fight off an infection and she could get even sicker.
Well, I don't know what you mean. I haven't seen her have any problem when I give her something to eat.
Well, unfortunately, we saw that when she swallows, the food and drink go towards her lungs, and she doesn't try to cough it out when it goes down the wrong pipe. We aren't seeing a sensory response. Unfortunately, she currently isn't able to protect her airway. So the safest route that we can recommend for her is to not eat anything by mouth.
So you're just not gonna help her at all? How long have you been doing this? A day? You can't even help her eat? Everyone eats. She's been eating her whole life, and now you're just gonna tell her she can't?
I'm hearing that this is frustrating for you, Mr. Pearson. Your wife has been getting by for a long time now, and going from being able to eat some things to nothing is a big change. Why don't you talk to me more about how you're feeling?
Of course I'm frustrated. All I want is my wife to enjoy food like she was before, and no one wants to help her get back to that. There must be something you can do.
I hear you, Mr. Pearson. I can assure you that we're here because we want what's best for Rebecca. This process can be overwhelming, and we want to make sure that you and Rebecca are helping us to decide the path here. Her whole team wants to help you both decide what her next steps will look like.
Yeah, I talked to some doctors today about that.
I saw you met with the palliative care team. Can you tell me a little bit about what you took away from that meeting?
Well, everyone's acting like she's gonna drop dead tomorrow. They were saying that the doctors don't even want to help her anymore, and now you're saying she can't eat anything.
The palliative care team's job is to start talking about how Rebecca can be most comfortable in her life given her complicated medical situation.
Well, if you're trying to make her comfortable, why can't she eat?
Our decisions about Rebecca's eating is all part of the conversation that the palliative care team began with you earlier. Truthfully, it comes down to what you and your wife decide you want for her moving forward. From a swallowing standpoint, we see that Rebecca's swallow isn't functioning the way it used to, and cognitively, her dementia prevents her from being able to safely swallow and use the swallow strategies that she was using prior, which is something that we would typically recommend.
I know she's not getting any better.
Unfortunately, with what we know about the nature of dementia, we don't expect Rebecca's symptoms to improve over time. Did the palliative team talk with you about her code status today?
Yeah, but what does that have to do with her eating?
Well, with her current full code status right now, our safest diet recommendation is that she doesn't eat anything by mouth, because she is at such a high risk for aspiration and developing pneumonia again. If you both decide to go this route, her doctor might consider exploring another source of nutrition for Rebecca. However, if it was decided to change her code status to DNR or DNI, we could go ahead and work with you to determine comfort foods for pleasure.
So you're telling me that if we decide to change her code status to DNR, DNI, she could eat again?
Yes, if you both decide to choose that option, we could further discuss what comfort foods Rebecca could be given.
Can I talk it over with my wife when she wakes up?
Of course.
Sweetie, it's me. Can you wake up? You know that I just want what's best for you, and you and me are a team here, and I'm not making any big decisions without talking to you beforehand.
It was clear at the start of the exchange between Jack and the SLP that Jack's awareness level of his wife's medical situation was minimal. This often leads people to believe treatment will cure the problem and life will remain the same. In Jack's case, this means he has difficulty recognizing the significance of Rebecca's problems and what they mean for their future. Additionally, Jack began displacing his feelings of fear, anger, and frustration about his wife's situation. The SLP responded with affect by identifying and acknowledging Jack's frustration and change in body language given the sudden change in his wife's ability to eat. She then attempted to redirect his anger by providing clearer education in words that he can understand and options reassuring his involvement in this discussion. Finally, the SLP gave hope-enhancing responses by making statements that show her confidence in the client's ability to handle the challenge. By allowing Jack to feel comfortable that he and Rebecca are active in the decision-making process regarding his wife's care, this allows for a more productive dialogue between Jack and the SLP that is less charged with accusations and negative feelings towards the medical team. Creating this trusting environment can demonstrate an SLP's regard for the client and their caregivers during a difficult time. This is the humanistic therapy approach at work.
I'm gonna be by your side through everything. And now we'll get to make your favorite apple pie, and you can eat it to your heart's desire. Just like we used to. Doesn't that sound great?
I hope I've made it clear to you that there's no pressure in terms of what you would like us to do moving forward, and I'm here to offer any information to support you both as best I can.
Thank you, Kate. I appreciate all the time that you've spent with us today. When you take the time to slow down and treat us like people instead of another chance to make money off of our woes, it makes the process a little easier.
Of course. Is there anything else I can do for you and Rebecca before I leave?
No, thank you though.
Okay. Well, our team will continue to work with you and your wife through the process if any questions do arise.
So you're telling me that, oh no, sweetie, it's me. You and me are a team here. I'm not making any big decisions without talking to you beforehand.